Hey team, so today we're going to go over how to improve knee mobility after either some type of knee surgery. So we're looking at a total knee replacement or an ACL reconstruction, and both of those require us to start progressively gaining knee range of motion. Now here's the thing, I let all of our patients know that we need to improve that range of motion right away. We need to start trying to regain it sooner than later, because strength, all of the muscles, quad sets and all that stuff, that will come. It will come. We will be able to regain that. 6 months from now, we can regain your strength. But range of motion, we got about 6 weeks after surgery until it gets really hard. Hard mentally for you to keep pushing, hard mentally for your therapist to keep trying to push you and you allow us. And then the third part is it just tightens up. All of the tissues in there are starting to tighten down and bind back down after that surgery. So it's really important that we regain your range of motion to your knee sooner than later. So here is the absolute #1 perfect way to start gaining knee mobility. So we're going to start with your butt all the way to the back of the chair. We want a chair that either has handles but doesn't roll, doesn't move. It's stationary on the floor. What we also want to do is we want to take your leg and bring it back so that your foot comes back to where it feels tight in the knee, but not uncomfortable. You could sit here for 10, 15 minutes and not have it ache or be a problem, but you could keep your leg in that position. That's your starting point. You're just essentially taking up the slack in your knee, so then it makes the stretching easier, okay? So at this position, we put a nail in the foot, and we do not want to move the foot at that point. The only thing that moves at this point is the body. So we can take our hands, we can put them on our hand rest, we can use them on the chair, and at this point we're going to slide forward until we feel a good pull in the knee. So the heel can come off the ground if it needs to as you go forward, because you might run out of ankle mobility, especially as the foot gets underneath you more. But you're going to hold 10 seconds on. Oh man, and you're going to push pretty good. You want it to be pretty intense. So you're going to hold 10 seconds on, then you're out of it, 10 seconds off. And you're going to keep cycling 10 seconds on, 10 seconds off. We only want 10 seconds because to push longer than 10 seconds is going to create a lot of difficulty for you. It's hard to maintain a maximal push for 60 seconds. But 10 seconds, we can wrap our mind around it. We can definitely do it. Our key is we want to just start progressively gaining range of motion to the knee. That's what we're looking to try and do. And this is the great way to do it. And I'll review it again. The foot slides back, the butt's all the way to the back of the chair. This is a comfortable position. We use our hands to slide forward, 10 seconds on, 10 seconds off. A little tips too. Get a chair that has a slick surface or put a garbage bag underneath it. If you put a garbage bag underneath it, you're going to slide easier and it won't take as much, such as this cloth chair. That's an easy way to do it. The other thing that you can do as well is if you find that your foot keeps sliding, let's say your motion's only about to here, and as you keep coming forward, your foot slides, then do it up against a wall. So when your foot goes to hit, or starts to slide, it hits the wall and it can't move anymore. So face the wall and do this as well, and that will help. Once the foot gets more than 90 degrees underneath you, then it's not going to slide because of the forces that are applied to it. Overall, team, I hope this helps with your knee replacement or your knee surgery in which you're trying to regain some range of motion to the knee. Overall, team, we want you to have the absolute best recovery. Feel free to reach out to me, make a comment on this video, or contact me at the office and say, hey, I need help with my knee stretching, and I would absolutely love to help you. Thanks for watching. Hit subscribe if you don't mind, and leave a comment or a like, whatever you like. But overall, keep on moving. Thanks, team.